Okay, maybe you could start by introducing yourself and tell us what is that you, what your role is.
All right, my name is Kester Cyrus. I am the Health Services Administrator for the Richmond Hill Institutions, which includes the Montgomery Psychiatric Hospital. Some of our greater challenges has to do, one, with the whole issue of discrimination for our patients, resources, available resources, and when I say resources, not only financial but also human resources, because some of our key staff members we need that we do not have, for example, a psychologist, in the whole area of rehabilitation. We really need some key staff members to assist us. I know one of the issues we always speak of, also the whole issue of having a halfway house, because we have a number of our patients who, after they live here, they are outside and they find a lot of difficulty. So these are some of the issues that we look at, and of course the financial resources. Although financial resources, we make do with what we have most of the time, but if we have some more of those resources, I believe we can do much better.
What are the biggest barriers, do you think, to implementing the programs that you would like to see? Is it more than just money?
Some of the programs we want to implement, in addition to money, we also need persons, especially at a higher level, to have a greater buy-in and shows that they are really part of it, because I think sometimes those things get stuck at a higher level. So in terms, for example, our revised Mental Health Act, it's still sitting at the Attorney General's office after a number of years, and so that shows that sometimes if we have the people at a higher level just giving us a little more support, I believe we can get some of our programs going.
Very good, thank you. And now our next discussant will please introduce yourself to our audience and give us your role.
Doris Gibbs Douglas. I'm one of the doctors here at the hospital. My position is that of a senior registrar, and I've been working at this institution for over 20 years. My role basically is to look after the medical and psychiatric aspect of the patients who present to us. So it includes doing a full physical examination on those patients, mental status information, doing a formulation of the case, a differential diagnosis, and coming up with a plan. Now, some of the challenges that we are faced with here, I know that Mr. Cyrus has already mentioned quite a few, but for us as clinicians, one of the things that we really would like to see is have a specialized center for children. Recently, we are seeing more and more children at our patient clinics, and we do not have a facility for them. So what happens is that the children are admitted on the same ward as the adults, and that's not really good practice. So that's one of the major challenges that we are facing. We see children with all different disorders, ADHD, conduct problems, you have children with depression, with anxiety, autism, and so on. So it's quite a lot to manage in the facility that we have now. So that's one of the main challenges that we are faced with. Another area again is that of the psychogeriatric patients. We do not have a separate one, so they are housed with the regular psychotic patients, and when you serve creates a lot of challenge and a lot of incidents, because sometimes we do find that the younger guys will take advantage of the older persons, like hitting them and so on.
Do you find that there's the political will in the country to support greater resources, or do you think there are barriers to creating an atmosphere where there would be more support?
We are hoping that we'll get more support. I mean, what we really need is quite a lot. So the ministry have always supported us and have always given us, the assurance that they would help us. But I think they too are faced with a lot of challenges and so on. So it will be difficult to answer that question wholeheartedly. But as of now, they have always, given us the assurance and the goodwill that they are willing to do what they can. But the situation is really dire in the sense that we are seeing many, many children at the clinic and our hands are tied, so we have to admit them sometimes at the pediatric ward, and it creates situations down there for the pediatricians also.
And from a public health perspective, where do you think mental health fits in terms of going forward?
In terms of going forward,
From a public health perspective, as opposed to a medical perspective.
From a public health perspective, because Grenada is it's a very tiny island, and from a public health perspective, I think that there's a lot that we can do, we need to do in terms of informing the public about mental health. There's still a lot of stigma that I think keeps back whatever growth we're hoping to achieve, because people are still very unwilling to come to the service because they know that they'll be judged and stigmatized. So in a sense, from a public health standpoint, we have not seen much progress in that area in terms of everyone being able, willing to accept someone with a mental illness and see what they can do for that person within their community.
Thank you very, very much.
You're most welcome.
And now our third participant. Thank you for adjusting your position. So please introduce yourself and tell us your responsibilities.
I am Joanna Humphrey, Senior Nursing Officer, responsible for the nursing aspect of the psychiatric unit in terms of managing our human resources and ensuring that they adhere to nursing policies, procedures, and the quality of care that has been delivered.
And what would you say are the biggest challenges your programs face?
Well, in addition to what was said by the two previous speakers, I would just like to focus on the community services, because within the hospital, the patients are being, get the treatment and so on with the psychological support and everything. But we don't have enough community support. We don't have a halfway house. We don't have some of the services that we would like to see in the community, so that we'll be able to maintain the patient, so that they can live in a community for a longer period than having this regular readmission. So community support, we need to improve in that area.
Do you see some barriers to getting that community programming started? Besides, resources, resources, are there any other barriers?
Well, one of the barriers I think that we face, in addition to the financial support, is also the human resources available to run these programs. Programs such as, education, and the whole collaboration with the team, like the religious organization and so. There is a level of commitment and support, from the other organization, the non-governmental organization within the communities. But I think we need to collaborate more and more committed to the cause.
I want to close our interview, each of you, to address public health master's students and give a personal message to them, because they are very interested in global mental health, and maybe there's something you would like to say to them directly. So could you start?
Students out there, I think you have chosen a noble area to be in. It's public health. It only help other persons, but you as an individual. It also helps you in your management of yourself, your family, and so on. So I think it's a good way to go. And even we're talking globally, I hope that there will be some program or some activity that you will do to engage us in Grenada. I want to be in person, but via the social media that we have, based on our communication. I hope that we'll be able to hear something from you. We are waiting. Bye.
Thank you. Doctor, so a message directly aimed at the public health students?
Well, for the students, what I would like to say that first of all, mental health is a wonderful area to work in. Working with a patient who has a mental illness, to me, it's a marvelous opportunity. And what I'd like to say to you is that take advantage of it. Remember that every case is different, and there's a lot of suffering that we can alleviate And it is not, what we don't want is that you judge the patient just by the behavior, because many times the behavior that they present with is not what they're actually feeling. So it's really, really important to understand that a patient may appear to you maybe not cooperative, a little bit aggressive, but underneath there might be quite a lot of psychological pain, and we can actually help them. So if we can go out, inform people, educate the population about mental illness, because stigma we know exists not only here in Grenada but worldwide, and people need to understand that anyone can become mentally ill. It doesn't have to be someone far away, and if we do help them, we'll be helping our community or society, because that's where they reside. They live within our society. And if we have one person with a mental illness within our society who's not receiving the adequate attention, then it can disrupt the life of everyone who's there. So that's what I'd like to say to you. Learn as much as you can. Don't keep the information to yourself, but pass it on.
Thank you.
Well, what I have to say here is this: the management within the mental health system is very important, because if you do not have adequate management, things can just go haywire. So you as students, while you are learning all the principles, we hope that you see the management as very, very important, so we can manage the resources, we can manage the financial, human, especially the clinicians and other support groups, so that we can do all we can for our patients, especially, so that our patients can have a better life, and they can live a life that is more acceptable by the community. So I wish you all the best, and please study hard so that you can contribute to globally and also locally. I thank you.
Thank you very much. That was excellent.